Hi, my name is Jessica Colvin, and the person that I chose to interview for this assignment is none other than my counselor, my therapist, Gracie Young. Gracie is actually my second therapist. She actually interned under my first therapist, Logan. When Logan got married and moved away, Gracie became my therapist. And I have been very fortunate because I loved Logan and I love Gracie. So Gracie has, of course, received her bachelor's in psychology and her master's in psychology. And I think she said that it was in clinical mental health. And she works as a clinical mental health counselor slash therapist. So she works at community counseling in the Oktibbeha County area here in Mississippi. She conducts intake assessments. She diagnoses, treatment planning. She does clinical documentation. She conducts individual therapy sessions and group sessions, and many of those are court ordered. And she also works with children within the Starkville School District. She also has a caseload of, I think, maybe 60 cases. That's a lot. So, yeah. She stated that what she finds fulfilling about her job is providing an environment where her clients feel safe. She loves watching them grow into the best versions of themselves. She loves when they get that aha moment, when something clicks, and she was able to help facilitate that. She loves witnessing growth. That definitely fulfills her. So what she finds challenging and frustrating, she used the word frustrating, is that when you work with community counseling, they also have resources and other benefits for the clients, such as clothing and food, and they have resources and referrals if you need help with your bills, if you need help with shelter. So she often runs into those that aren't necessarily there to receive the help when it comes to mental health or counseling. So she finds that frustrating, where she's not able to really assist those that really need it or could need it, or they don't take the therapy seriously. And so she finds that very, very frustrating. She also stated that she understands the hierarchy of needs and wants to help those that are less fortunate receive the things that they do need. But, you know, it can become frustrating when she's trying to do her part and the clients aren't willing to do theirs. She hates feeling that she is not able to help someone, or that she wasn't able to help someone. She really finds that challenging. So, to help facilitate her training and her learning, she is under a licensed supervisor. So she has someone to review her cases. If she has any questions or if she needs any help, she's always able to go to her supervisor. She is subscribed to psychology journals. She attends trainings in person and virtually. She stays up to date on trauma certifications. She loves self-help. Anything that comes out with a self-help book. She loves reading and just expanding her knowledge. She loves it. She loves psychology. And so her recommendations for those who are going into psychology is: one, it is important to take care of yourself. You are not able to pour into others if you are empty. Working with people and their emotions can drain you. So you have to take care of yourself to avoid burnout. It is imperative. So number two, you have to set boundaries for yourself, not only for your patients, because it's important to do it for your patients, but you have to set boundaries for yourself. You have to make sure you do not become overly invested in an unprofessional way with your clients. You have to make sure that you detach as well. She also said that you have to stay informed. Science and trends, they change and evolve. You have to stay up to date on information, and you have to stay up to date with your trainings. And she also stated that the moment that you think you know everything as a therapist is the moment you should not be a therapist. So you have to continue learning. You have to continue going after that knowledge. Okay, you should have goals for your clients, but you have to make sure that those goals are realistic. You have to know your clients. You have to meet them where they are. You have to make sure that you are patient, you are compassionate, you are empathetic, that you're not pushing. And I think that's definitely one of the things that I'm going to have to work on. When they need to talk, they need to talk. You know, maybe they just need someone to listen instead of you just putting in your 2 cents all of the time, or becoming upset or frustrated that they're not moving at the pace that you think that they should move at. So, you just have to be patient and meet your clients where they are. You have to remember that when it comes to therapy, you and your client are partners. They are not able to grow simply because that's what you want, or you want them to do something. They must do the work. And for some reason, if they don't commit themselves to the work, it is not on you. You cannot take that up on yourself. You can only do what you can do. Do not have your identity tied to being a therapist or a counselor. This is what you do, not who you are. You have to make sure you know who you are. You have to make sure that you find the balance in your life, and try not to bring your work home. And don't bring the patient's problems home with you. So you have to make sure that you carve out that time for yourself to be you. You have to have that wind down. You have to find those things that you enjoy to take your mind off work, to clear your mind, to focus. It is imperative. She said she could not stress that enough. You have to take care of yourself. You have to take care of yourself. And so I really enjoyed talking to Gracie about these things, these questions. I am really excited about my journey, and just being in therapy and watching her work as well has really truly opened my mind. She doesn't push what she thinks that I should do on me. She lets me talk it out. She really gives me another perspective of thinking. And I'm very, very grateful for Gracie. And I am really happy that I was able to do this assignment. Thank you.